My name is Dr. Linda Camp, and I'm a board-certified plastic surgeon. I'm new to Salem Regional Medical Center, and I'm excited to bring good skin health quality to the programs that we offer for our community. A question posed to me is, why is it important to protect our skin? Well, skin is much more than a covering, and we know it's the largest organ of the body, but to be an organ, it has to serve many functions. Some of the things that skin does for us is it protects us from our outside environment of temperature, sun influence, mechanical injury, and even chemical injury. But it also provides us an immune function that surveys our skin surface to keep it in health and in good check. It also has a vitamin function where vitamins are transformed to a more usable state that our body can use for good nutrition. It gives us temperature control in different aspects of our body surface to maintain our internal temperature. And it also is important sensory perception to help us perceive our world for danger and for pleasure. So we can protect our skin from damage, and it's important to understand how to protect our skin. Everyone's skin and eyes are exposed to UV radiation just on a daily basis, even in front of your computer screen and sitting under fluorescent lights. We have exposure that we should be aware of and protect our skin surface from. So people of light skin color have decreased melanin in their skin, therefore lighter skin tones. And UV damage is much more affected on lighter skin tones than darker skin tones. So skin exposure to UV radiation is a big impact on our skin health. And skin exposure to toxins, whether they are ingested or internal consumed toxins versus skin exposure. The internal and external toxins can influence our skin both short-term and long-term. So in talking about protecting our skin, photo damage is one of the biggest influences of our skin health. We know that sunlight actually suppresses the skin's immune function, and that immune suppression of our skin can help promote skin cancer. But even UV radiation alone is a carcinogen. What that means is the more that your skin cells are exposed to UV radiation, the more damage the DNA suffers, and it begins to degrade. And over time, that degradation of the skin health, the skin cell health, can lead to precancer change, to atypia, and finally go down that slippery slope all the way to skin cancer change. So UV rays do damage the skin cell health. Exposure to these rays is the factor in most skin cancers. While sunlight is the main source of UV radiation, we also see high doses with tanning beds and tanning lights that you may even have in your home. And you should be aware that they can be causing harm to your skin. UV rays damage the DNA in the cell, and the skin cancers start when this damage affects the DNA and it can no longer provide healthy growth and replication of new cells. So skin protection, I think there's really four main things that we should focus on to protect our skin. This would be as simple as staying well hydrated. Drinking lots of water is important so that our water content can flush away waste and bring good nutrient to the skin from inside the body. Water also can wash away the toxin and waste that are excreted to the surface of our skin, which helps maintain a more healthy skin surface. Nutrition, such as vitamin supplements or a nutrient-dense diet, are very important to maintain healthy cell turnover and give the vitamins and supplements the cells need to maintain good health and decrease the degradation to an abnormal state. Then a skincare regimen. What do I mean by this? I just mean good skin health, where you cleanse your skin on a regular basis, you exfoliate, especially our face and our hands, which are so exposed to the sun and frequent damage. Even here in the Northeast, our wintertime exposure can lead to skin changes that we should be aware of and continue a daily regimen. Products that we offer in this office are a medical grade skincare line called ZO that can help with those exfoliation and skin changes to improve the quality of skin, improve the thickness of skin, and decrease the aging effects that we see from UV radiation. And finally, sunscreen really should be part of your everyday regimen. Even in the winter, we're exposed to UV radiation. We should be able to use a topical sunscreen that's at least a 35 to our face and hands. It should be on a daily basis. And if we're going to be in more sun-exposed surfaces or sun exposure time in the day, you can even get zinc added to your sunscreen, which is very protective. And nowadays we have sunscreen that has a base called Parasol. In the past it used to be PABA, and people were really sensitive to it. It was very oily, almost kind of a greasy topical. Today's sunscreens are so much improved that they are easy to reapply and they're very well tolerated. So skin cancer in our part of the country is actually pretty common. We know from the American Cancer Society that skin cancer is diagnosed in about 1% of all adults. And some other literature reports that in 1 year, 5.5 million skin cancers are diagnosed, and these diagnoses were found in 3.3 million people. So that tells you if you have one area that's suspicious or changing, you possibly could have even more than one. And if you think the main cause is UV damage, it is not just that one spot that was influenced, but the whole area that was exposed to sun. So the whole area can have the damage and transform to changes that are not healthy in the skin. I wanted to talk a little bit about skin tone, because we know that melanin can be protective, but even if you're an individual with darker skin tone, you still have cancer risk. The melanin can only protect so much from UV damage. So even darker skin patients have a risk of skin cancer when they have excessive exposure. But the fortunate thing is that most skin cancers can be identified early if you're aware of a changing lesion or something new or unusual in your skin. And when we can find lesions early on, we can treat them very successfully and most often for cure. So the earlier we can diagnose and treat, the better the outcome. So I just wanted to show some pictures of examples of skin lesions. The first series of pictures are really non-cancerous lesions, but these are changes that happen with age, such as seborrheic keratoses. These lesions are benign, but they can be itchy, they can have change, they can even have bleeding. Any of those things would be warranted to be examined by a skincare expert. The next thing is a large freckle, bigger than your small freckle the size of a pinhead, but a larger freckle that's consolidating, maybe the size of your fingernail, of your little finger. That would be called a lentigo, which is a sunspot in common lay terms. These are really non-cancerous, but if they're changing, really should be examined. Then we move on to the next type of lesion, which would be a precancer. These are commonly called actinic keratoses. These are precancerous to a squamous cell change, which is a cancerous change in the skin. These are also brought on by UV sun exposure and radiation. These precancerous lesions can change to become malignant. And in fact, some of the pictures I have to show, there's a field of damage that is actinic damage and squamous cell all in the same area. So actinic damage looks dry and scaly. It's often seen in the sun-exposed areas, more about the face, hands, and chest, more in older folks who've had a long time to have sun exposure and those damaged cells to replicate in their damaged state. Actinic keratosis, early basal and squamous cell skin cancers are most commonly found in the head and neck in the sun-exposed areas. They're also usually very treatable, again, when we can find them early on. So we do have a picture of some of these skin lesions, with the top being the actinic or precancerous damage, the center picture being a basal cell skin cancer lesion, and then the lowest picture is a squamous cell cancer that we see on a patient's face. I just wanted to talk about some treatments that can be offered early on, and specifically we can use some topical agents that can slowly chemically burn away the damaged cells. We can scrape them off or shave them off with surgical techniques. We can also use a photodynamic therapy where you would have an injection of a medication and then treated with a topical laser system to help improve your skin quality. And we sometimes have to surgically remove lesions that might be too large for these other treatments or might be too deep for these other treatments. And that would be your skin expert who would determine which of these methods might work best if you have a lesion that's suspicious and is recommended for biopsy. These are the most common types of cancers and precancerous lesions that we could see. But then, of course, the next type of skin cancer that we as physicians are always concerned about would be the melanoma skin cancer. Melanoma is notorious to be a look-alike skin cancer. It can be anywhere from a dark black pigment all the way to normal skin tone. And it can have a variable nature in how it appears. It can be flat or raised. It certainly can be ulcerated. It can even develop, and most commonly can develop, in a pre-existing mole. So anytime changes are happening, these are things that should be examined by a skincare expert. Again, just having dark tone on your skin does not protect you from melanoma. And we kind of divide melanoma into a couple types. The common sites of melanoma are the arms and the back, and the uncommon types are on the palms of the hand, the soles of the feet, and even in the nail bed, we can see a dark stripe coming and growing out with the nail. These are very suspicious lesions and should be examined and could be a melanotic change or even a melanoma. There are some examples of melanoma pictures that will be presented with this talk. We can see a melanoma beginning in a pre-existing mole, and that dark undulating surface of new growth is very abnormal. We can see a pre-existing lesion on the bottom picture that just suddenly started to change color. The lesion itself did not grow, but its color started to change. So when things are changing like this, really should be examined as well. This brings me to how do you identify when something needs to be inspected by an expert? And we physicians use the ABCDE model, so it's important to know your alphabet. So A would stand for asymmetry. Normal behaving moles or lesions should be symmetric. If they have an irregular change on one side, or maybe a corner squared off, or a shooting growth out the side, that's asymmetric. That's abnormal behavior. The border should be a smooth border, whether the two-dimensional perimeter is smooth or the growth off the skin, the three-dimensional shape, should also be smooth. There should be no center ulceration or jagged edges on the two-dimensional border or the three-dimensional growth from the skin. C then stands for color. Normal lesions and moles should have one color. If there's more than one color, that's an abnormal feature. So diameter would be 5 millimeters or less. That's smaller than a 1/4 inch, or 5 millimeters in growth would be considered normal. Once we get above those numbers, it's abnormal in size. So the diameter is larger than the normal diameter. It would be an abnormal feature. And finally, E for evolving, or I also call it environmental change. If you have a mole that you never noticed before and now you notice it, it's become sore or itchy, it's more sensitive, it's on your arm, and when you put your coat on, wow, I noticed that, I never did before. That's an evolving change. As surgeon, if you have 2 of these features that are not normal, I'm going to want to consider sampling that lesion and sending it for test. Sometimes those lesions are small enough we would just remove them when we sample them, but A, B, C, D, E. Know your alphabet. When you're concerned about a lesion, run this simple model test. If there's 2 abnormal features, it really needs to be examined. So I just want to pull all this information together to say our skin is so important to us. We really need to honor it and protect it. Things that we need to do is do a self-exam on a regular basis, identifying lesions or moles that we have and noticing them if they're changing. If there are 2 unusual features or something that seems to be sudden and rapidly changing, it really should be examined by a skin expert. Next, if you're going to be exposed to sun, you really need to be sun protected. You need to have sunscreen on. They even have clothing that has sunscreen protection. You can wear large brim hats and avoid the greatest sun exposure or UV exposure from about 11 to 2:30 in the day. Those really extreme intense UV rays are going to be the most damaging at that time. We also can watch our outdoor activity and try to get water resistant sunscreen. Other things that you can do is to protect babies and children from those sunburns and sun exposure. Plan indoor activities during the hot time, have a siesta during the hot time, or just be cognizant, maybe underneath a big umbrella, because those babies can be protected from skin cancers when they get older, because we're protecting their young skin now while they're little. My age of child, when I was small, we never wore sunscreen. Sunburns were very common, but we know now the sunburns we had as children are what promote our skin cancers today when we're adults. So help your children, help your babies, and protect them. Examine your skin from head to toe. Look for those 5 features of A, B, C, D, E, and see a skin expert when these are changing. And finally, should you be concerned about your skin health? I think everything I've said in this presentation says yes. We need to be aware of our skin, any changing lesions, be sure to be sun protected as much as possible, and anything that's worrisome, concerned, or changing, have a skin expert. You can start with your primary care physician. If they're concerned, they will send you to a specialist who would then determine if management would be needed more than just observation. If you have any questions or you have a spot or 2 you would like to have examined, we at Salem Regional Medical Center want to promote good skin health to our community. We're offering a complimentary skin screen. You can call the office and arrange for a complimentary visit. I would look forward to seeing you and giving you my opinion on the things that you might be concerned about.